I'm Bill Bergstrom with RMA of Southern California. I'm here with Dr. Thomas Kim, the medical director of RMA of Southern California. Dr. Kim, what should patients know about egg freezing?
Egg freezing is our way of preserving and protecting women's reproductive potentials because ovarian tissue has a very different characteristics, the way it functions, unlike any other tissue in the human body. Although women's life expectancy has grown a lot longer over the last 100 years, women's general health conditions might have improved, but ovarian function still remains the same. So when we look at the number of eggs that the women are born with, initially there are about 1 million eggs when a girl is first born, and by the time she starts ovulating, the numbers go down to merely about 100,000. And throughout her lifetime, that attrition rate is tremendously fast. So even if she may have a very good general health overall, as women get older, egg quality declines continuously. So egg freezing is our way of preserving and protecting women's reproductive potentials. When we look at the statistical chances of each egg becoming an embryo, becoming a baby, women in their 20s, it takes about 6 to 7 eggs to make a human being. In other words, not all eggs are healthy, normal, strong to become a life form. And once she goes into mid-30s, it takes about 10 to 12 eggs. Then towards late 30s and 40s, maybe about 15 to 20 eggs. And that ratio continues to deteriorate as women get older. So egg freezing is our way of stopping that metabolic process. By taking the eggs out of the human ovaries, we can suspend that egg quality at that woman's age. So our recommendation is to try to get the eggs out when she's young. Recommended ideal age would be less than 35 years of age. We'll continue to engage in somewhat older women, but they have to understand that it'll take a lot more eggs to find that, so to speak, golden eggs to become a life form later on. So that's what egg freezing is. The process of egg freezing is by using a fertility medication, because we need a lot of eggs. And by stimulating with the fertility medication, we can create multiple eggs. And we monitor their response. And when the timing is right, we'll extract those eggs and cryopreserve in liquid nitrogen tank.